Okay, so you guys ready, right? So I will open the room, sorry.
But she does smoke like a 1 pack per day, and she teaches. She has no significant in the family history. The review of system, she appeared to be uncomfortable, but the rest of the system is normal. Like she not feverish, the pulse is normal. Physical exam, she appeared pale and unwell, but she's oriented to time and place. S1, S2, no chest pains, no murmurs, bilateral breath sound, no wheezing, no crackles. The lab tests show with the CBC, the hemoglobin was 9.5 gram per liter. The platelets was 219. The HCG is 32.262 69. We did the ultrasound. Then we found there was a large amount of free fluid in the cul-de-sac. And we also do the ultrasound. Yeah, so for now, anyone would like to order some of the new tests? Or you want to take a look at the CBC and the serum HCG level? Okay, I'm going to continue. Yeah, the transvaginal ultrasound, we found a 4 millimeters anechoic lesion that suggests a pseudo gestational sac, and an irregularly contour rotational sac adjacent to the left ovary. So the cranial length measured is about 17 millimeters and was consistent with a 8 weeks 1 day gestation with a fetal heart rate of 162 beats per minute, and a moderate to large amount of complex free fluid were present in the cul-de-sac. Then this is the image of the lab test. For now, anyone has any question?
Okay, can you understand about the ultrasound image here?
Because they have like the note on the picture. I think that I kind of understand the image.
And can anyone interpret the image for everyone?
Yes, the uterus is in the left side of the picture.
Yeah.
And the left ovary is in the right side.
Yeah.
And between them is the fallopian tube. Fallopian tube.
Yeah.
And the embryo is outside the uterus, and inside the fallopian tube. But it's really big, and the tube might be ruptured.
So Dr. Zoon, did she have the right interpretation from this the image, Dr. Zoon? So Dr. Tao has the right interpretation for this image. Right interpretations. Did she explain the ultrasound image?
Yeah. I think it's correct.
So it's correct.
Yeah.
Good. So we can just move on. Thank you, Dr. Zhu. And also thank you, Dr. Pham. So after we have the ultrasound results, so she became remarkably tachycardia. So can anyone explain to me what is happening with the patient? Anyone has any ideas?
I think right now the patient have a hypovolemic shock. by rupture ectopic pregnancy.
When you type it down, is it like the patient is having?
I say, in this chest vaginal ultrasound result, we can just confirm that this patient have ectopic pregnancy, and after having lab chest vaginal ultrasound results, she become remarkably tachycardia. So we can just we don't know the how severity this tachycardia is, so we just can consider it as a symptom of bleeding, but is occurs right after this chest vaginal ultrasound. But so we also need to monitoring this case more strictly. I think that's my opinion.
And Dr. Zhu, do you have anything else to add? Okay, I'm just gonna move on so we can leave the question later on, so it can be answered by Dr. Zhu. Do you have anything else to add at this point?
You can you just move on.
Okay, I'm just gonna move on. Yes, this is the surgical presentation of this patient. So the patients underwent the laparoscopy. So so anyone has any idea what we should do with this in case of this emergency for in this case of the patient?
You mean what will we do with the patient when she have the tachycardia or after the surgery?
Yeah, so what we should do in case of this tachycardia?
Anh asked, right? Who asked? Thảo, right?
Yeah.
Asked like the patient have tachycardia or before we do surgery or after do surgery, right?
No, actually, because Anne asked what would we do with the patient, and I asked him, he talked about which situation, before she have the tachycardia or after she have tachycardia or after the surgery. I mean, I understand what he asked, but I want to confirm about the specific time, right?
Yeah. And then can confirm again.
Yeah, so what we should do after the patient has the tachycardia, so what do we should do now before the surgery? So now she became tachycardia. So what was the next step that we should do?
Well, I mean that we can, after we do the vaginal ultrasound, we can kind of have the diagnosis. In this case, is she have the ectopic pregnancy in the left fallopian tube. So and then she have the tachycardia, which might the suggestive symptom for the one of the member have said that she might have the volume, she might have the sudden anemia due to the loss of blood into the abdominal cavity because of the rupture of the ectopic pregnancy. And at that time we have to do the surgery as soon as possible to stop the bleeding and cut and take out the ectopic pregnancy.
Yeah.
And also resuscitation with fluid, with intravenous fluid to the patient. Yes, that's what I want to do on this patient.
Yeah, thank you, Dr. Clark. Anyone else has any other ideas? Blood transfusion and then surgery for hemostasis. So Dr. Viet has and also Dr. An, we have to clarify whether tachycardia is a result of ectopic pregnancy ruptures or not. So in this case, with if the patient, the cause of the tachycardia is the result from the ectopic pregnancy rupture, then what we should do next, or what would should we transfer her to the OR now, to the operation room now, or what we should do, Dr. An?
As I remember, since I studied OBGYN, I think it's 1.5 years ago, I think the ectopic pregnancy rupture is an emergency case, so
yes,
we have to emergency surgery, and also we need to stable his hemodynamic.
Dr. Dung, is there anything else you would like to add?
Yeah, so I think that what I mean is what will you do if there is not an operation room available right now? So what do you do in the emergency room to maintain the life patient?
If I think if we don't have available operation room right when the patient have this condition, so we just have to constantly monitor monitor her at the emergency room, and also try to keep the patient hemodynamic is stable.
Okay. So what do you think about some kind of blood transfusion, emergency blood transfusion?
Yeah,
So
just
yes.
like Dr. Viet suggests.
So what do you think? This
I
is
think depends on the patient's vital signs, right, and also the lab stat as well.
so but the lab stat is the hemoglobin is still low, right? The hemoglobin is still low, and
It's
the
just
patient vital sign is is notable with tachycardia. So what do you think? Blood transfusion or fluid
if
or fluid transfusion?
in this case the hemoglobin is just 9.5 gram per liter, and just the vital sign like the heart rate and blood pressure is still in normal range. Or patient have tachycardia, but it just indicate that patient is having an bleeding condition right in that time. So I think we just have the IV line just in case.
So one IV line or two IV line or something?
Central like IV line.
Central. Oh yeah. So you will have
in
one.
case the patient have shock, right?
So you mean like one central one central IV line and one peripheral IV line, or just one central IV line?
This is more details for me.
Yeah, this is really hard to think about. Yeah, but I think in case of hypovolemic shock, we just need to two peripheral IV line, or like one central IV line and one peripheral IV line, right? So the first thing we have to do right now is that we have to transfusion. We have to prepare the OR to perform the surgery for the patient.
Yes, I see.
The most important thing is that we have to this kind of hemostasis. Right?
Yes, we just need to try to stabilize the her patient, our patient hemostatic.
Yeah.
But I think we also need to repeat our task, like we need to repeat our abdominal ultrasound too.
So, what do you want to know when
the amount of blood? I think we have to.
But in the abdominal ultrasound result is we have a large amount of free fluid in the cul-de-sac. Yeah, so I think it's not necessary to take the abdominal ultrasound again, right?
Yes.
Okay, so Dr. Ann, you are going to move on the surgery presentation.
Yeah, could you do the surgical presentation for me? This is I will transfer the slide and you do the talk, please.
So in the surgery presentation we have, let me see. So okay, so the patient underwent laparoscopy. The ectopic was clearly identified and the remainder of her tube appear normal. Therefore, saphenectomy with excision of the ectopic pregnancy was performed, but this was complicated by breast bleeding. So pressure and bipolar cautery were applied with unsatisfactory result. Those bleeding was too brief for hemostatic agents and interrupted. So 6 polygalactin sutures were placed. Yeah, and a bright red oozing was not from a suture area. Therefore, a thrombometric hemostatic agents were applied that we can see in the right image. So the area was re-inspected and was confirmed to be hemostatic, and the patient recovered unevenly. Yeah. So I think the most important thing is that the patient that she has removed the right side fallopian tube, and if you want to give her with IUP, I mean the intrauterine pregnancy, in the next time we need to recover the right side, the left side tube, right? So the conservative surgery was performed in this case. That's why we don't remove the left side tube. We just take the ectopic pregnancy and and then in suture the left tube to give her pregnancy.
Can I ask something?
Yeah, okay.
If we try to, to suture the left tube, and I think that the risk of the stenosis of the left tube, yes, it becomes smaller. It's really high, and for the next time she pregnant, there were higher risk that she would have the ectopic pregnancy again. So why wouldn't we suggest her, recommend her to do IVF? Because I think that she have it's really risky to let her be want to have natural pregnancy again, and IVF is more safe. And
I see.
And the operation will not be so difficult, because I see in the camera the fallopian tube is really small, and and with the abdominal cavity is full of blood. In that situation, it's really hard to to surgery precisely.
Yeah, but this is kind of emergency situation, right? So we don't have time to explain with the patient or the family of the patient that we have to remove the left side fallopian tube if we can conservation the surgery. So the most important thing is that we have to do anything to keep the tube intact. In the next time when we have pregnancy, when her have pregnancy, I think it's the patient is still at risk, but it's not. It's just kind of you can still have IUP normal, but it's not 100% with ectopic pregnancy in the next time, right? So we have a small percent, but this is not the real percent, right? So this is kind of quite a situation when we have to treat in an emergency situation, and we just need to keep everything remain. Are you clear with that?
Yes, I agree with you.
Thank you.
I have another question. That as said that in this case is an emergency situation, and the patient have not unstabilized vital signs, right? So why we choose in this case why we choose the laparoscopic instead of just open surgery, as I think is a lot of save time for this patient.
Oh, in this case we have we underwent the laparoscopic.
Yes.
Yeah.
Why we don't choose another choice like open surgery?
But I think laparoscopic is okay for this kind of situation. Yeah. So you think that when the patient have so large amount of blood in her abdominal pain in her abdominal cavity, so we have to think about some kind of abdominal surgeries. It's not laparoscopic, right?
I mean that as I believe that in the conventional open surgery is more safe time for this case, because the patient, her vital sign is not stable, and if we take the laparoscopic, we had to form some trocar rod, right, and also we need to put some gas on her abdominal cavities, so it's more take a lot of time more than the open surgery. I think that particularly this is an emergency situation.
But you know that her general status is unstable, right? So if we have to do some kind of large large surgery, the risk to get some kind of hypovolemic salt is more.
I think it is controllable in this in the OR, right?
Yeah,
you can do some
so.
Blood transfusion, and because in this case there are a lot of blood in the abdominal cavities, so the laparoscopic have very less reason than the open surgery. I think that the reason in
so because why didn't we choose some kind of less invasive surgery to replace for some kind of more invasive surgery? Because I think laparoscopic surgery is okay with this. We can remove, we can drain the blood in abdominal cavity. We can take the ectopic pregnancy and suture the fallopian tube with laparoscopy. So why don't we do that?
I think the major reason, for my opinion, is just it is an emergency situation, and we need to take every second to try to have the patient in stable, and the laparoscopic is take more a lot of time.
So you think that the laparoscopic is take more time to do instead of the? I don't think so.
That is
because this is kind of less invasive surgery, so you can use some kind of trocar in her blood in her belly. It's not have some kind of suture. It's not some kind of incision in her belly, and we just need this more easier. Because like in appendectomy surgery, this is kind of emergency situation, right? So, but we just need the laparoscopic surgery. It's not use some kind of open surgery, And
So it depends on the patient's vital sign.
yeah, it's depend on. But in these situations, when we bring the patient in operation room, we have essential thing to give her status is stable. I think it does not need some kind of more invasive surgery. Is replaced for some less invasive. Yeah, but her her opinion is like, why don't we use the open surgery to solve the problem with less time than the laparoscopy surgery. Yeah, but this is
So which one will take a longer time?
Open surgery.
Really? The open surgery is more time than the laparoscopy.
I think this is the risk benefit matter, because when you have to indicate the open surgery, this is okay. This in some cases it's will let the patient with it will solve the problem with the less time, but this keeps her at risk in the next pregnancy, because she has an incision in her belly. This is kind of a risk factor.
Can I have some idea?
Yeah. Okay.
I think in this situation, open, open surgery is an option, but like the laboratory is way more beneficial for the patient, not only in the surgery but also post-surgery. I mean that first the laparoscopy will have less invasive to the patient body. They only have three scars in the belly.
Yeah.
And the invasive in the other organ in the abdominal cavity is way lower, way less than laparoscopy, way less than open surgery. I mean, not only the ovary, the fallopian tube, we also have the gut in the cavity. So if we do open surgery, we have to take care of the patient, not only about the reproductive system after the surgery, but we also take care of her with other complication with the gastrointestinal system. And also the open surgery take a lot more time to recover than the laparoscopy. And and so even maybe the open surgery take less time to the surgeon can enter the abdominal cavity. The laparoscopy is way more beneficial for the patient, and we and the patient just just have the severe symptom, like she do all the tests in the clinic, then she have the tachycardia, and therefore we have more time to
To prepare.
we can some like delay, not like delay, but we have more time to prepare for the patient and prepare for the operation. Like we can have like intravenous fluid, we can we can transfuse fluid to her to keep her the hemodynamic like we can keep her hemodynamic stable. And then we do the laparoscopy, and I think with the development of technology in the hospital right now, we have to choose like such a invasive surgery on the patient.
You get my point. So I think to sum up, we don't mind that open surgery is not suitable for this situation. The route of surgery depends on the triad of the surgeon comfort and experience with laparoscopy, the patient history, the patient progression, and the anesthesiologist comfort and experience. So even in the setting of hemoperineum, laparoscopy is considered a standard surgical treatment. So in this situation, the problem is some kind of the indication matter is when we can indicate some kind of laparoscopy surgery, we just do this.